Hey, what's up? This is Ellie and this is Niki again on our channel. And we're going to do a podcast today about Niki's top surgery revision, which he just had, which is why he's wearing that ridiculous thing that I'm wearing. And I'm wearing the ridiculous thing that I'm wearing because I had top surgery almost a month ago. And oh shit, if this is your first time to the channel, if you've never seen anything up here, so I'm a trans guy, non-binary one at that. That over there too is, maybe it's over there, is also a trans guy. And we talk about trans stuff and we do a lot of profanity. We talk very clearly about technical terms. What else do we do that's not cool on the internet?
We exist.
We exist. Yeah, we exist. And yeah, that's the content warning. Niki, so what the fuck happened? Tell me, what's your week been like?
Crazy week. So I had top surgery initially in February, along with my hysterectomy and ovarectomy. And I developed what's called dog ears, meaning a little bit of excess tissue underneath the arms.
Yeah.
This is something that happens to a lot of people after top surgery, but any kind of surgery really well.
Can you turn your volume up?
Yeah, 1 second.
Okay.
Can you hear me better?
No.
No? I'm all the way up now.
Okay, good. Let's go.
Yeah. So
top surgery in February, just in case somebody's watching this in 3 years. February was 7 months ago. 7 months ago.
It's September now, so yeah.
Math. Not my thing. Okay.
Yeah. So I developed dog ears, a little bit of excess tissue underneath the arms. What I was going to say is it happens with a lot of surgeries really where, you know, the tissue grows together funnily a little bit. Yeah. Don't let anyone tell you that's because of your body fat percentage or your muscle mass or your weight. That's just not true. If you have a lot of chest to begin with, chances are you're going to develop dog ears. That can be very demotivating going into it, knowing that you might need 2 surgeries. The upside being this revision is so minor. For me, it took 20 minutes.
That's it.
And it's optional. You know, most people choose to never get it, but I wanted to get it done. And I hope that this was it now. You can't really tell this until a couple of months in when everything has healed and the swelling is down. So what happens for me is in June, I'm 4 months post-op and I say to my surgeon, look, I have dog ears, I've been to physical therapy, and I don't think they're going away. He says, send me photos because he's 2.5 hours away from me. I do it and he says, yeah, we can do that. And I get the next appointment, the next free one, and that was beginning of September. It was a bit of an organization nightmare because I need to go to the clinic the day prior to have my counsel with the anesthetist and do all the paperwork. So I leave in the morning for an appointment that is supposedly at 2. At around 2, they tell me the earlier I come, the better. The earlier I can leave again. So yeah. I'm there at 11. And they tell me, no, your appointment was pushed back to 2, the earliest.
Mm-hmm.
Just sit down and wait. Okay, so I end up waiting there for 4 hours.
Man.
For 2 minutes. For 2 minutes with a fucking doctor. And then I have to go back home again because I didn't find a hotel for the night.
That sounds like an ER in a very bad place. Okay,
it's ridiculous.
My screen is dancing, so I need to adjust something.
Yeah. I'll just keep going. So I drive home for 2.5 hours again. And my plan initially was to take the train. What happens the day prior?
Yeah.
Is that every union goes on fucking strike. Power to them, I'm not complaining. Every union goes on strike, and I believe 75% of trains here, blocked. Forget about it. Oof. So on Wednesday, I have to organize. I'm leaving for Thursday, I'm leaving for Friday. I have to organize how I'm going to the clinic and how I'm coming back. Now, thankfully, I found someone to drive me. But that wasn't the plan. And not for 4 hours of waiting and 2 minutes of talking there. But yeah, I go back home and would you believe it? I get into a traffic jam and construction and everything comes together. I get travel sick anyway, so I get a tension headache, and by the time I'm home, I can't stop throwing up, essentially. TMI, but yeah.
No,
And all of
you're
that,
here for this, you know?
all of that because of 2 minutes in the clinic, you know? Why don't we do that the day of surgery? So ridiculous.
Okay, so yeah, so just just to introduce a little bit, maybe if someone's watching this and they haven't watched the other streams. So your surgery was a double mastectomy with 3 nipple grafts, right?
Yeah.
And I mean, it sounds like you had a lot to give up. And so having done that surgery, you actually during recovery noticed that your scars were swelling up on the sides of the armpits, right? That's the dog ears.
Not the scars, excess tissue below the scars.
So
when the skin sticks out, that's what it is.
The skin
for some people that's more round, looks like fat. For others it becomes triangular, pretty sharp. So for me that got rounded. It looks like fat under the arms, but I didn't have it there before. Okay, and that's why I said in our last videos you can't train or diet it away.
So it's an accumulation of tissue that's
created by the
surgical.
surgery.
It's not like something they didn't take off during the surgery.
No. No.
This is a post-surgery, like small complication that can be easily resolved.
Very common, very easy to fix.
And to have it resolved, you had to contact your surgeon who doesn't live in your town, right?
Mm-hmm.
He lives 4 hours away, right?
2.5 hours.
2.5 hours. Oof, what a fucking drive, man. Okay, so you had to contact him and you did it with photo because it wasn't like you mentioned, I think, having not seen him at all, right?
Yeah.
And he calls you in and he says, okay, we can fix this, but you need to come to the clinic. And then they set you up with a date. And then there's the whole back and forth of going to that date. And that's and then you come in and they basically operate on you and send you back home, right? That's like the large picture. Okay. So there's a train strike that sucks like really balls and
it sucks balls.
It does.
It's okay, you know.
Oof. So they had you wait 4 hours in the waiting room. So you can see the doctor
with an appointment.
Oh, nice.
With an appointment. Like people, the other patients were commenting that I was still sitting there, you know, when they were done, they were like, oh, you're still here? I was like, yeah, I'm still here.
It sucks. That sucks.
Yeah. But I go home and I don't feel good at all, you know. And then the next morning, my surgery is scheduled for 7 a.m. So I leave at 4 a.m. Like I said, wanted to go by train, had to go by car ultimately.
Yeah.
I couldn't sleep. Nerves got the best of me. I don't know why. It's minor, but I just didn't feel well. It's really difficult for me with all the travel. Now I'm very punctual. I'm very much on time, and I'm sitting in the clinic.
Yeah.
And my surgeon is nowhere to be seen. And man, you know, the day prior, even they sent me to so many different wings of the hospital. Go there. Because even though my appointment was in the computer, I told you this, they didn't know where to send me. No one was really responsible for me. So add that on top of the waiting time. And the next morning, like 5 minutes before my surgery, the same thing, right? Go there. And they tell me to sit outside on the floor, and I do that. Half an hour later, my surgeon still isn't there, right? I'm supposed to be operated on at 7. It's 7:30, no one's there. All of a sudden, this other doctor, who I only know because he's operated on some people I know, walks by, and he goes into the nurse's room and asks, is Niki there? And the nurse who told me to sit down, no, he's not there. I sit outside the door, right? And I get up and I knock on the door. Hello, are you Mr. So-and-so? I'm Niki, I'm here. He says, oh, okay, come with me. We draw on you now. And while he's taking me to draw on my chest, he says, I don't know who you expect to operate on you, but Dr. Schwarz is not here. Well, good thing though, his two colleagues, I saw their results at my initial counsel. And like I said, I know people who operated on them. Exactly the same great results that I have, no problem. But I did have an appointment with a guy who operated on me in February. Okay, so it's all pretty rushed, you know, he noticed this, and he tells me, so what do you want? And I say, well, I sent him photos and this and that. Then says, I can see that, but it's pretty minor for you. Say, yeah, I agree, but I want this done. Gets out a Sharpie, draws on me, says, okay, go outside. I give you your file, and then you go to the operating room, you tell them who you are, and they do a COVID test or two. Like, I've already had so many, it's ridiculous. Just tell them who you are and I'll be there shortly. This I'll be there shortly took another hour while I was waiting there.
In the operating room.
In the operating room.
Waiting for an hour in the, oh my fucking God, oh my God.
Yeah.
Oh, God. I would be stressed out of my fucking mind.
I wasn't any longer because I was just glad it was happening, you know? My fear is always that it's not happening. Be this, I fucking pass out on the way, I get into a car crash, train sounds, strike, surgeon calls, sorry, I'm not here today. We've had a positive COVID case, we can't operate on anyone, everyone go back home.
Yeah.
That's what's in my mind.
Yeah.
Once I'm there and it's happening, I'm calm. So I'm waiting, they bring me the shirt for surgery ride and go through my files and ask me again, who are you? What are you here for? I'm calm. And the whole team there in the operating room was really cool. Unlike the team prior, like I said, the nurses were really weird, were saying I wasn't there. And one thing that I skipped over that I'm thinking of now, so the day prior when I had my counsel, I got misgendered so much, and that's really ridiculous because this is the one clinic in Germany that has so much experience with trans people.
Yeah.
From me going to check in to the different wings, to see the nurses, blah, 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 sitting around. Every single one of those people has my file in front of them, and it says female to male transsexual, transgender patient, gender conforming surgery, those things. I am not noted as Mrs., Miss, feminine, female, woman, anything there. There were quite a couple of nurses, quite a couple of doctors who insisted on referring to me in the feminine form. And this is not a question of passing if it's medical personnel that has your file in front of them. This is malignancy.
I mean, this is so strange. You mentioned this before, and it's like, first of all, you're having a top surgery revision. Yeah. Second of all, you correct these people. Third of all, they're used to this line of work. What is the bottom line here? Why? I literally, I cannot see a motive, you know? Fuck motive. I can't see an explanation. It's just like, what is this about? What is this for? It's completely counterproductive, you know? Like, why? It's so, and the other thing about misgendering in documents, right? So this can actually be kind of problematic for transgender people, because like when you have your paperwork done and your paperwork says female and you're male, or your paperwork says male and you're female, you know, or you're neither, this can actually cause quite a few problems. When I was here in Spain getting my initial papers done, you know, my first residency card or something like that, and it's like a temporary residency, and it's like it has to be super accurate, because otherwise when you want to renew the residency you can't, you know. It's like the Spanish bureaucracy is such a complicated and really frustrating and mal operated institution, and it's like if you get something wrong, you're really fucked. And I go there and they take my details and they tell me, okay, come back in whatever. And I come back in whatever. And they give me my card and it says male.
Mm.
And I had to do the following. I had to say, my documentation is in female.
Yeah.
Please correct this because
Terrible situation.
I cannot use this residency card.
Mm.
You know? And they had to call a guy and and it took another week. But it's like, we have to be so aware of the people handling our shit, you know? Because if we don't do it, then you don't get operated on, or you don't get your visa, or really important shit doesn't get done because they think you're not you. And you're like, this could be really like, this could all not happen if we don't use gender markers on identification cards. Like, why do we need gender? You don't take my religion, you know? You don't take my eye color. Why do you need my gender?
Exactly. And that's the thing, because my card says X for neutral. I don't have a male marker, I have a neutral marker. That's what I decided for myself. But at the clinic, they asked me, neutral or male, what do you want? Because what my papers say is one thing. I don't have female papers, so I don't have to be addressed like that. But that's exactly why I said it says female to male or transgender or transsexual, rather than just saying in the medical papers, female or male or neuter. So they know what you're here for.
Yeah.
And that's why I said that I wanted to put on mine female to male, so that everybody who comes in contact with me in the clinic knows what I'm here for, and that nobody addresses me as a woman. Now, when I said they had no idea where to send me, even while at an appointment, and I was on all these different stations, I had to keep showing my paper.
Yeah.
And that says my name. It says gender male, because I requested it. And it says what my surgery was. They see that, and even though they can read that, and they have to read it in order to see where I'm going. Hello, we have a female patient here. She doesn't know where she has to go. No. Now, I go to the next station and I say, listen, someone just called for me. The nurse referred to me as a woman. You can see from my papers. And the next nurse goes, no, I can see you're trans. It's okay. It's okay. So it wasn't all a disaster. But if people want to do that to you, they will do that to you, you know?
Yeah. You can't stop it. You can't really, like, it's this constant thing, like with transphobia, like, do I fight this? Do I try to be nice and explain, which takes up a lot of energy? Or do I kind of like pretend I don't care and just let it build up, you know?
And I tell you, the further I am into transition, the more it bothers me and the more ridiculous I feel, because guys, I've had a mastectomy.
Yeah.
Among other shit. I don't have to play girl any longer. It's so ridiculous. It's much worse than it was before. So yes, I'm correcting it, but it falls on deaf ears very often.
Yeah.
But next day, when I'm there for the surgery, so I'm saying doing all of this in 2 days was completely ridiculous.
Yeah.
Next day, once I meet the doctor, it's good. From that moment on, everyone refers to me as he and Mr. and male and whatnot. So once I'm in the operating room, it's good.
Yeah.
Before, disaster.
Okay.
Also, I still don't get what the nurse was trying to accomplish by saying I'm not here. I'm sitting right outside the room.
So the one thing I can think about is maybe she was not concentrated, and because she was looking at the registry and something female to male, she was like, we don't have a female out there, so you're not there.
I have no idea.
But I have to really, like, in Hebrew we say
acrobatics,
somersaults in the air.
Yeah.
To kind of give an explanation why she would do that. Honestly, it sounds like a dick move, and that's it. Yeah.
So the only reason why I caught on that is because I was sitting right outside of the room, right? That's why I heard it. Otherwise, I didn't know the guy before. who was operating on me that day. I would have never known that he was talking about me, and we would have missed each other, and then everything would have been pushed back another hour or so.
Yeah, and plus, like, good thing you didn't have headphones on or that you weren't distracted or
exactly. Because
Yeah.
I'm sitting there and I'm waiting and I'm very much on time and I'm aware of my surroundings.
Yeah.
Where's my doctor?
Yeah.
Okay. I'm in the operating room, all is good. Everyone is joking with me. Everyone is really respectful, much better than before. Really.
Nice.
Surgery takes about 20 minutes.
And you were put under, or you had local?
I was put under, yes.
Okay.
Because I requested it. They could have done it with local numbing, but it most of the time doesn't do anything for me. And I have a very high pain tolerance, but I must not exactly have all of that happen. It's okay. I would have preferred at that point no numbing rather than the numbing shots because they hurt. But when the numbing doesn't work, it's a clusterfuck. I don't need that. So I said, no, we don't do it without any anesthesia. If so, we put you under and that's okay. So let's do it. Very, very light anesthesia, just a mask, no intubation or anything. 20 minutes, boom, I'm back. I barely have any pain, just a little bit of burning.
Okay.
And they give me something to eat. Say, get up, walk around a little bit. And then if everything is fine, in an hour, we'll give you your papers and you can leave. So very unspectacular on the day of surgery. The worst was really the day before. Yeah.
Okay. And so what they do in the surgery, do they open the cuts? Do they come in from like another angle or?
It does depend on what you specifically need to have done. For me, because it was only a little bit of tissue underneath the arms, I can show you this in a moment. They just open up the far ends of the cut. So this is all as was before. And the very ends, they cut into rows and then suck out of it. That's how we do that.
And what's like the healing times? What's the rehabilitation perspective on this?
So they said to me again, like the first time, the only recommendation they can give me is 6 weeks, no workouts, no straining, no exhaustion. 6 weeks because it takes scar tissue 6 weeks to form and wounds to close. Beyond that, same as before. My surgeon said I can bench after 6 weeks. And I said, no, I can't. But I'm also not going to take off 3 months again, you know? So I'm going to look, what are the next 2 or 3 weeks like? What do the cuts look like? And we'll see. I'll keep you up to date. I don't know, but I'm definitely taking it easy for 6 weeks because I figure this was so minor. It would be stupid if everything bursts open again because I'm getting impatient. And I can tell you, I'm much less restrained than I was with the initial surgery. I almost don't notice anything was done at all, which is why I'm saying I'm restraining myself. It's very easy to do too much too soon.
This is really something that I think people who are very athletically inclined, like us, for whom training is a really big part of life, and you know, I think for a lot of trans people, like especially towards the masculine side of it, working out can really be affirming and really be a good way to manage dysphoria, anxiety, and a lot of other emotions that go with transition, because muscles are masculine and sweating is masculine, and we're like, we like that, you know, we're like the boys in the gym. And
and it's a good way of using up your energy, you know.
And for us, the stuff about not moving, like, we're so used to being tough guys and my pain is not important, you know, and being like and being like in competition with male bodies and testosterone abundant bodies, you know, and being like, I'm not weaker than you. I can mentally, I can take more, you know. You may be bigger, but mentally I can take more. And we have this mentality of like just power through, you know. And then you get to surgery, and there's Ivan Coyote is a non-binary reference that I kind of want to link here. So they're a non-binary Canadian storyteller and performance artist, and they've had top surgery, you know, and they come from a very like, they talk about their experience, and they come from a very like culture of like stiff upper lip and like not talking about difficulty and not sharing difficulty and definitely not asking for help. And they talk about like having the operation done, and I remember like the phrase that they used in the book that they wrote was that in order to get this part of my body masculine and more masculine, I had to really drop the patterns of behavior that I learned from the men in my family. So like they had learned from the men in their family that you don't ask for help, you know, you need to be physically strong under any circumstances. And if you hurt yourself, it's not a big deal, you know, and never let anybody take care of you. And during their recovery from top surgery, they had to let their partner take care of them and like not overexert and listen to their body. And it really rings with me, like the stuff that you're saying now about your recovery.
Yeah.
And
yeah, difference being I don't have anyone to take care of me, but I definitely have to take care of myself, and that I let things lie. Yeah. That's also self-care. Not always doing everything all the time immediately all by yourself, but saying right now I'm not able to do this.
Yeah.
And that's something that I've had to do a lot doing the initial surgery for the first 4 or 5 weeks. And now I barely notice I'm operated on. You know, that's why I say I'm restraining myself, because I know it's a little bit fragile still and I don't want to hurt myself. But yeah.
So self-care is another big one, you know, like what do I need? What do I need to not be doing, you know? And it's kind of like a lot about paying attention to your body and your mental state, which also when you have dysphoria, one of the things you're more likely to do in order to deal with that is disconnect from your body. You don't want to be in your body. These are not pleasant sensations, you know?
Yeah.
Walking in the street, knowing that you look very far from what you need to look, it really makes you like step out of your body. And this is not a body that for a lot of years you wanted to care for. And
exactly.
Yeah, and a lot of people deal with this body like with taking a lot of substances, or with self-harm, or with eating disorder. I've done a little bit of like eating disorders and a little bit of self-harm and a lot of drugs, you know. And physical activity is one of the good ways to do that. But it can also be abused, you know. And all of a sudden after surgery, you have to be in your fucking body.
Yeah.
And understand, you know, what's going on with you, what you need. And to answer the question, what do I need right now? That's hard, right? That's hard.
Definitely is. And I can just tell you, on one hand, my surgeon, does he even lift? No. I was like benching after 6 weeks. Yeah, nah, I can see that that's not happening. But on the other hand, I also wouldn't have expected that I would want to rest for 3 months, right? And the only reason I did that was because I had top and bottom surgery together. And I was really afraid of hurting myself.
Yeah.
In that way. And also very surprised just how exhausted I was from just walking the dogs, from just buying groceries, something like that. But at the end of the day, I look back at this, I was patient and I've done everything right because I've come back so strong. This is ridiculous. I'm stronger now than I was before surgery. Oh. And I've only been training for 3 or 4 months again. And I'm so much stronger now than before. It's nuts. So now this time that I'm waiting to heal up here, I'm again not in a rush to get back to it because I've really done everything right last time. And I feel pretty fucking clever about that. And to tell you the truth, I've been going at it so hard for the past couple of months that I'm just glad to get a break now. You know, like I want to sit on my ass and play video games for a couple of weeks now.
Oh,
That's
this is so cool. This is so cool. Okay, so we're gonna do like a whole podcast about rehabilitation, right? Because I think you have a lot of knowledge, and I really think this stuff needs to be out there, you know?
Yeah.
And I'm a physical therapist. I'm not gonna give physical therapy advice, but I'm gonna talk based on my experience. And like I was in the gym today, you know, and I was thinking like, wow, ever since I did surgery and I got the okay to start rehabilitation, like the rehabilitation was like this. And a training process usually doesn't feel like this. So actually training, the passage between rehabilitation and training, that moment when rehabilitation turns to training is actually very enjoyable, you know?
Yeah.
And you can use that momentum, like you use this momentum to really build a fucking solid routine, you know?
It's been crazy. I didn't think that I would be back at it so fast and so strong. It's nuts.
You want to just give us a quick wrap of your numbers, you know, just
Sure. I'll be real quick about it because I don't think people watching this video will care too much, and we'll be talking about it in detail soon. But
just the last workout, you know, just like
sure.
Yeah.
So my idea initially was that I would be doing some light rehab stuff, like something you would see in physio, just to see how much can I move around without pain. And I noticed very fast that wasn't needed because I was so mobile, because I kept moving around very early in recovery the first weeks, obviously without weights or anything, just seeing how far can I take it. So then the second or third week I figured, and I start using plates and dumbbells, just like stuff. And then I'm immediately back to my barbell and I start deadlifting again and rowing and squatting, and also started introducing the bench press with limited range of motion, going deeper every session. And I do this for 5 times and I'm back to normal. As a matter of fact, stronger than before. So what I did was like 2 or 3 months back into training, I PR my deadlift, right? Like I put on like 5 or 10 kilos from before, and I'm doing crazy rows every week that I didn't do before. So that's that. I've done everything right.
I don't think you would have been able to outdo your best performance if you hadn't built up correctly.
Yeah.
Like
my training was absolutely crazy before surgery because that was my doomsday in my head, right? I had this appointment that I was waiting for 14 months. 14 months is a long time to get crazy about it.
Yeah.
And I figured I'm going to give it everything I got, but I got to be smart about it because it's also a long time to get injured or to get burned out. I'm tapering it up. I'm always doing more and more and more, and it's going really well. And I figured I'm as well prepared as anyone can be. But still, recovering from it, I didn't think that I did it so well, but I was clever about it. Yeah, I surprised myself. Yeah, that's all I can tell you.
At those 14 months, how long were you on testosterone?
So I was given the appointment in December 2019, and I start T in February 2020. So I'm on it for 11 months.
Okay, so that also helps the graph, you know.
Only endurance wise, I can tell you in that time I didn't have any added muscle mass and also not really added strength. It was really just keeping the rest times down and feel fresh faster. So that helped. But honestly, it doesn't really matter what you're at or where you want to go, because only thing that you have to keep in mind is how much does this fatigue me, you know, and how intelligent is the programming and how productive is the stress. And that's something that you can do at every weight, at every composition, at every age. You just got to see, is this productive stress?
Yeah.
And it turns out that I've made some intelligent decisions regarding the stress that I'm putting myself on before and after surgery. But we are going
to do a full podcast about how you did it and what decisions you took and like the steps. We're gonna lay it out because I think this is like precious information.
It is. And now that the surgery, this revision is so minor, my comeback from it is not going to be as spectacular. I'll just start training normally in a couple of weeks. But I'm glad that I don't have to train for a couple of days, maybe a couple of weeks now, and I just get to really also mentally recover from it. The physical aspect of it is often talked about, but we don't really, put enough emphasis on what this does to a motherfucker in the head.
So what does this do to a motherfucker in the head? Like, I want to hear about
I'm
that.
tired. I'm exhausted. That's what it does.
Yeah.
I'm anxious. I'm stressed. I'm nervous. And my brain needs to process, this is behind me now.
Like the whole thing.
The whole thing.
It's fucking over.
It's over. Because I can tell you, for some reason, going to this revision, even though I was the one who wanted it, it wasn't medically necessary.
Yeah.
It was an aesthetic thing. I felt like a lamb going to the slaughterer again. And I don't know why. I had this really strong central nervous system response, this really strong autoimmune response, that I felt so fucking sick going into it. And I don't know why, because I was really looking forward to it. I want to be done with this,
Like, so you're telling me like meant like in my head I wanted to do it, and in my body did not want to do it.
Yeah. Mm-hmm. Essentially.
That is hard to take, because it's like, come on, buddy, come on, get on board.
Yeah.
And was that as bad as the first surgery? Was it worse? Was it better?
It was almost as bad as the first surgery. I couldn't sleep the night prior. My heart was pounding out of my chest. I don't know why. Because for the first surgery, that was the biggest day of my life. And I was so scared of everything going wrong, the entire thing being canceled. Of course, I was a nervous wreck.
Yeah.
The second time, I don't know why my body decided to process that way. I don't know.
So one reason, as someone who's had a surgery before, top surgery, could be that on a physical level, your body has a memory of the trauma.
Yeah.
And your body's like, please.
My body was fighting it with everything it had. These 20 minutes of snip.
Yeah. I've had back surgery before top surgery, and it was in 2013, so 8 years ago.
Yeah.
And
the body remembers.
It is so fresh in my head. Everything about the surgery is so fresh in my head. I could literally tell you what happened, like on a second-to-second basis the day.
Yeah.
And well, the important bits, clear as fucking daylight. And it's like, I think it scares a lot of trans guys that the night before surgery, they don't want surgery.
Mm-hmm. Yeah, it's the thing. I really, really, really wanted it, but my body was saying.
So there's like this schism. There's like this big contrast between what you want and what your body wants.
Yeah.
And you're like dragging your body like a cat by the tail, and it's doing anything that a cat dragged by the tail is going to do, and you're like, we're doing this,
I remember thinking, I can throw up 30 times more. I can get into a car crash on the way. I can pass out. I'm going to the clinic. This is happening now.
Yeah.
Like, no matter how bad I'm feeling, I'm going to make myself go.
Yeah. Like I was surrounding myself with people before top surgery to make sure that I go.
And that's why I took a step away from everyone, and I said, I need to be alone now. I need to calm down, not get any more stressed, and get on with my life, or finally build a life. That's how I saw it, because before that wasn't much of a life.
So how, in that respect, like, what has top surgery like liberated for you that you can do now that you couldn't do before?
Well, I think the obvious thing is something like, I step out of the shower, and then I can wrap a towel around my waist. Like, I've heard Elliot say that, right? Like, how happy he is just about that. Or you can go, when the wound healing is finished, swimming topless or sunbathe a year or two out when the scars have healed. Something that we spoke about last time, when you take the stairs or you jump, you don't feel this moving here. Your clothes fit different.
Yeah.
Even clothes that you didn't like so much before, or that you dearly wished you had fit into, now you might try them on and you think, nice, you know. And even if people are figuring you out and your passing is not great, still, when they look at your chest, they won't see breasts. When you notice someone looking at your chest, you're like, yeah, fucking look at my flesh.
Go ahead, baby. Take a good hard look at this teethless chest, you know.
When you need to go to the doctor, need to take your shirt off. When you want to be intimate with someone, take your shirt off for that. All those are things you need to learn how to do it. You need to realize this has happened, I'm safe now.
Yeah.
And those are the steps that you're taking. I think cis people take them for granted. This is something that I've noticed I'm coming to terms with slowly now, like over half a year later. But I'm like, no, I don't have to put my hands or my arms in front of my chest when I'm walking around or taking the stairs. And I don't have to be embarrassed to take my shirt off at the doctor's, you know? And no one is looking at my chest because I have breasts. They're looking at my chest because whatever, let them.
I got a logo on my t-shirt, whatever. Yeah.
For example.
I think taking my shirt off at public functions, because like you commented in the last stream, like female chest is sexualized. So we don't do that. You know, doesn't matter how you feel about your female chest.
You know what other people are going to see. Yeah.
Are going to sexualize it. And not only do you not want it to be sexualized, it's like usually prohibited by law.
Sure.
Yeah. And it's like, I took my shirt off at the boys' locker room, yes, like 2 days ago in the gym. Yeah. And I'm standing there, towel around my waist, doing my scars, like doing taping, because I've trained and I was sweating and I had to change the bandages. And guys are walking up behind me, using the urinals, flapping dicks all over the place, you know? You do it. Just fucking do it. You know, no criticism, no envy, and no criticism, but they do it.
Just the fact.
Just swinging dicks. And then, and I'm there doing my tit stuff.
Yeah.
It was one of those moments where you're like, I would really love to be in touch with my feelings because I think I'm feeling stuff. It would be awesome to know what. I don't know, but it would be awesome. And we're going to talk about this in therapy. But it was a good moment, you know, it was a really good moment. And
you know what this reminds me of?
What?
Like last appointment at my psychiatrist.
Yeah.
I met him at the urinal.
You met the psychiatrist at the urinal. Oh, baby. Oh, wow. Wow. So when
like, I have arrived.
Yes. You've parked. like the car. Yeah, you've arrived. This is like long-term park. Like you're not getting that car anytime soon. You're not leaving, you know? You like set that ship on fire because you don't need to go anywhere back, you know?
Yeah.
Oh, wow. Okay. Yeah, this is definitely like the using the men's locker room after you've had top surgery is literally like this Viking thing of burning the ships, you know?
Yeah.
No way back. You've done that, no way back for me, at least.
Yeah, definitely.
And using the urinals, like, do you use a stand to pee?
Yeah.
You care to talk about that?
Pardon? What?
Are you okay with talking about that?
Yeah, sure. I am. I was gonna say, it's difficult to find a device that works most of the time because you don't want to piss yourself in public, bruh. You know? And they make something called female urination devices that most girls would be putting in a purse because it doesn't fit in the pockets, and they're plastic and whatnot. So that's probably what you don't want if you're trans. It's also not something that you can conceal in your pants very well. And then you have to see whether you whip something out of your bag, out of your pocket, or if you want a stand-to-pee device, that probably does look like a penis. And they make them in all kinds of price ranges. But the problem is it really has to fit with your anatomy, because otherwise you are pissing yourself in public. And
it's the thing. You're like standing there, you're like standing there and you're like, you have to kind of like, because otherwise you're going to piss your fucking pants, and your pants are on you. They're not even like they're not even on the floor. You just, if you miss, you miss.
Yeah.
So like, what do? You train? Like,
you have to learn how to pee again with that thing.
Fuck, man.
Yeah.
It's like,
so not a fan, but I'm also not a fan of public restrooms in general. And I think we can say this. I've been using the men's room for some time now, and the state of public restrooms, like regardless of whether you're at the gym or freeway or restaurant or whatever, my God, no matter which one you go into, men's, women's, unisex, you probably don't want to be there. Let's leave it at this. We don't need to expand on this.
Yeah.
But my God, at times the urinal is then the only option for you, A lot of men's rooms don't even have stalls any longer.
Or toilet paper. Like, what the fuck is that about?
When I was on my way to surgery, I needed to stop at the side of the road with a little freeway loo there, and where you put in a coin. They didn't even have stalls. They didn't even have toilets. They just had urinals. So then the question is your passing still in between where you could get away with going to the women's room? And do you want to? After having used the men's rooms for so long, can you get yourself to do that?
It's really hard. Like, when I have to go into the women's room to get paper, it really like makes all the times that I've had problems in the women's room, like really, it brings them up for me. The other day, Pride was yesterday in Barcelona, and I went with some friends, and we used the bathroom, and there was no toilet in the men's room, and I had to like, kind of like half step into the stall of the women's room and kind of like grab a piece of paper and go back to the men's room.
Yeah.
And I do that, and I cross that threshold, and I'm like, boom, memories.
I think something that's pretty clever for that is if trans people carry a package of tissues, like for wipes or tissues for blowing your nose, for toilet paper emergencies. I think that can be an elegant solution to that. It's more shit you don't want to have in your pockets or on your bags, but
I always have tissue paper. I don't know why I didn't have it that moment. And I was like, when I walked in, I was like,
and we're talking about this from an inconvenience and an embarrassment standpoint, but using the right restroom or locker room is also a safety concern. That's another topic.
For us, and for the female, for like the male to female, the trans chicks, a lot worse, and the safety concern is really not something that was big in my head when I started transitioning. I always had a personal feeling of safety.
Yeah.
And yesterday, coming back from Pride, I dressed up very gay because I don't look trans anymore. I have amazing passing, and I have to literally cover myself in glitter for anyone to think that I'm not like a cis straight guy.
Yeah.
And I have to do this, and I have to sit a certain way, and I really have to like show people that I'm not normative, And I had all that shit on, and it's nice. It's nice. It's a certain aspect of me that I like to sometimes show. And we did Pride, and I came back at 2 a.m. to my neighborhood, which is not where Pride was. Pride was in a very central part of town, and I don't live there. And my neighborhood is also the same neighborhood where I was surrounded by 5 guys who wanted to beat me up, calling me maricon. You know, we remember that one. Oh, by the way, the trial results are back. I need to do another video. It's a sad video, but I need to do it. Okay, so I walk back and I remember like, oh yeah, I almost got jumped by like 5 asses, 6. And there's a bunch of teenagers sitting on a bench drinking, you know, and I'm like, do I cross the street?
Yeah.
Do I call someone? Do I, you know, it's like, oh, this sucks. Because I can't even fight them. I've just had top surgery. I can't even run.
I know. When people hear safety, they always think, but what if men pretend to be women to get access to the girls' bathrooms?
That is not a real problem.
What they don't think about is what if we go to the men's bathroom, or we have to go to the women's bathroom because for some reason, and someone decides we don't belong there and decides to check what we are.
Or decides to make us leave. Or make us pay for being there. Like somebody decides that we're not supposed to be there or doubts our right to be there and decides to do something about it.
We talked about this before. Both of us had this happen in the women's restroom before we transitioned. That women decided we didn't belong there.
Yeah, quite often, more often than not. Yeah. And that is a strange mix of pride and hurt and embarrassment and
totally
fuck you, you know, because you go into the ladies' room and you don't really like the ladies' room because it says ladies, and you're like, you build up this whole case about bathrooms shouldn't be gendered, which they shouldn't be gendered, you know. And I think there's not a lot of trans people who would disagree with you on that. Wait, there's any number of trans people who would disagree with you or anything. Like, fuck that comment. Okay, so it is a general sentiment in the community that like the bathroom gendering is not productive, and you go in there. And you're like, you have spent so much time looking at that sign, you know, deciding to go in there. And you're doing your thing and you're like, when is this going to happen? Like, which one of you assholes is going to say something, you know? And then it happens and you're like, that's not as bad as the one I got last time. Or, ooh, that was rank. Or, fuck do you care, you know? And you're like, the whole time you're in the bathroom, you're just doing this, you know, instead of like peeing or texting, whatever it is that people do in the bathroom, you are here.
And I was at the point where if they only said something, they didn't push me, they didn't shove me, I was like, thank God, you know.
And then women don't really attack physically most of the time.
Most of the time.
Unless you really pass, and then they might bash you.
One thing that I've had problems with, especially in school, when there are groups of girls, you know, like totally mean girls like that. That's when they got bold. That's when they started shoving and pushing and trying to take your clothes off and hitting you and whatnot. Like fucking crazy shit that no one really deserves. And if you make those experiences in the women's room, then you ask yourself what happens in the men's room.
That is really interesting, because I think what happens in the men's room is a story we know very little about. I think what happens in the men's room happens to feminine men.
Yeah.
And we don't look like feminine men, you and I. Some trans guys do. Or some non-binary people who prefer to use the men's room do. And I think it's really different to be perceived as a female body in the men's room and as a male feminine or feminized body in the men's room. I think a female in this macho world of people who are actually transphobic is not something you can violently oppress unless you're raping it. You know, this is like the one exception. It's like, you want to be violent towards a woman? Rape her. Any other kind of violence is not acceptable.
That's the essence of it. Yeah.
That's the essence of it. Like, if it's sexual, that's cool. But if it's not sexual, you need to respect it, you know? Yeah. And men, like, okay, male bodies who are feminized are like anybody's ball game. You know, it's like I've actually spoken to this yesterday with two teenagers who looked like very typical heteronormative men who were actually at Pride listening to transgender stories. It was an event where some trans people sat down to share their experience. I was one of them, and it was like small groups, and random people from the Pride event would sit down and ask questions, and we told them. And I had the amazing privilege of these two teenagers who really look like they come from a part of society that is not easy on gay rights, you know, sit down in front of me and listen to me. They didn't ask a lot of questions, but they were very attentive, and you can see that they were there to listen, you know. It was beautiful. And at a certain point, we talked about, like, what does it mean to portray femininity in a male body? And I said, I think little boys who do feminine things just get beat up really hard. And they said, yes. And they were like, yeah, they beat you up. Yeah, they beat the shit out of you. Mm-hmm. Like, and I think that's not really something that happens to us in the male dominated spaces, you know?
Yeah. And there's also something to be said about, because once the question of passing isn't so much in the foreground any longer, you will be pleasantly surprised that most of the time in men's restrooms and in men's locker rooms, tunnel vision. Most of them, if you don't exactly look like a woman and you don't look very flamboyantly queer as a man, they probably keep to themselves. They really don't want to be caught staring at another dude's balls or whatever.
Because that's gay.
Because that's gay, and that's so they're not as attentive as women tend to be, you know, where they're looking around, they're scanning, they're looking you up and down, and you see, oh, she's thinking something to herself, she might say something. And if you don't stick out so much with men, you could be flying under the radar too. So that's really a double-edged sword, I feel. On one hand, the potential for escalation and sexual violence is much greater. On the other hand, you probably get to fly under the radar. And I'm at a point where people finally start to think I'm a little boy rather than a little girl. So that's how I feel. Yeah.
So at the point where you're starting to look like a little boy, you get so many passes. Like, society leaves you the fuck alone, you know?
Mm.
And this really happened to me yesterday, that after Pride, I was walking around the city, going to the metro and all the rest of it. And people are looking at me, and I'm like, whoa, 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 whoa. People have not looked at me in the past 2 years. And you get like this blessed silence.
Yeah.
Passing is really beautiful in that sense. Like, it's a beautiful privilege.
It is.
After years of gender variance, it's just, you know?
But it's very hard to get for people who look youthful, and people who are short. You know, I think that you really had the advantage there before, because I told you before, I think you had a relatively masculine build as far as women can have masculine builds, because you had a lower body fat percentage and a straighter, narrower.
I had huge fucking shoulders from day one, and my height is average for men in the country where I live in. Mm-hmm. So,
and you look your age. That's another thing. I'm really short. I'm chubby. I look very young. I'm tall for my age, so that's hurting passing a lot.
How tall are you?
156 centimeters, so 5'2" in Imperial.
So there are men this tall, but it's really far from the average.
And they've gone through male puberty, and they have a V-taper and thicker wrists and different jawline, you know. Those are things that are still to come for me, because I'm so early in my second puberty. And that's why I'm 28. That's why I don't look like it. I didn't look 28 before transition, 26, 25, whatever. And I especially don't look at it now, that I'm supposed to be much hairier, much bigger, much more muscular, much taller than I am.
You look at the beginning of a male adolescence.
Yeah.
You don't look
hope.
like you're at the end of a female one anymore.
I hope not.
Which is awesome. You know,
Yeah.
I mean, to me, it's also like how I know the person and what my mind kind of like assigns to them, right? So so to me, knowing you, knowing your story, knowing your pronouns, knowing your preferences, I just can't perceive you as a female body anymore, you know, especially with that pedo stash you're rocking. It's like, I love it. It's beautiful, man. And then like, it still doesn't compute as an adult male.
No. That's why I said a lot of youthful people have a problem.
Yeah.
I know a cis guy, my age, my height, he also has problems passing because he looks like he's 12, essentially, you know.
Also, it's like it's an ethnicity thing. Like white boys have beards.
Yeah.
You know, like a South American, ethnically speaking, South American person could get away with your hair and your cheeks, and you are so blatantly white that no, like, you're not bald and you don't have a beard. That kind of like fucks with you.
But you know, it's interesting that you bring this up because I get asked about my hair a lot, and my psychiatrist did it back in the day. My hair used to go until here, always, my entire life, because I never saw that as feminine. And I know that in a lot of cultures today, long hair stands for femininity.
Yeah.
But I will tell you, there are cultures in which it's not just not feminine, it's explicitly masculine. And in my family, all the men who haven't had extreme hair loss have long hair.
Oh, wow.
Longer than me.
Oh, wow.
Because this subset that I'm from, with my Greek, Albanian, German ancestry, we are called Arvanites. And the Arvanites, if you look at paintings of them from the Greek Revolution and whatnot, and if you meet them today, a lot of them have very long hair. And I mean until here. The men
that
keep
is so
long.
fucking cool, man.
Like when you look at Native Americans, a lot of them have very thick black long hair.
Yeah.
And people in Southern and Central America, like you notice, that's normal, you know. But again, looking youthful is not going to help with that. When the beard comes in fully, not just this fucking shit that I have now, then that's going to be better. And when I become more muscular, that's going to be better. But I got asked, especially when it was very long, and Bob was like, why don't you cut your hair? You look like a girl. Say, no, if I cut my hair, I'm going to look like what you think a lesbian looks like. That's not going to change it. It's more about hairline and whatnot and the rest fitting. Yeah.
So like the hair is an interesting dilemma, you know, because first of all, it's beautiful. You know, you have gorgeous hair, you have great color, you have great length. You know, the shit, it doesn't turn too like voluminous, and it's like it's beautiful hair. And this and the second thing that it has a cultural meaning for you, like the men from your culture have long hair. It's like a warrior thing, if I understand it, you know?
It is a warrior thing. Every single one of the men in my family was a mercenary, was a soldier. All of them have long hair. For me, when I was a kid, I threw a fucking fit when my mom came with a pair of scissors. Said, I'm a boy, I have long hair. That was my logic. I'm going to be a man, I have long hair.
Yeah.
And that doesn't mean that I don't want to cut it in the future to see what that's like, because I've never had it before. But I'm not going to cut it so people think I'm trying to look like a guy, hoping that will help with passing. No, I'm going to cut it when I'm done with it.
So I did a lot of shit around that. Like, for example, I would grow my hair out because I didn't want people to think that I cut my hair short to look like a boy. But I really wanted it short, and I kept it long.
Yeah.
Like some desperate attempt to show that I'm not trying to transition while transitioning. And it was gorgeous. I had amazing hair. It really, like, motherfucker is thick. I have really nice hair. And I couldn't stand it because I saw it as feminine beauty.
Yeah.
You know, because the culture I'm from, like the significance that's attached to it in Jewish culture is that men are either bald or they have very short hair, and women have very long hair, and if they're religious, they cover it.
Sure.
So to have like a short head of hair that's out in the open, it's like the most masculine thing you can do.
Mm.
And something I would do is I actually have like the hairline that I have is I have 4 years on testosterone, very feminine. So like the hairline, you can see that this stuff like this still has hair in it. Like I can't seem to grow, what do you call these? In Spanish, they're called entradas.
I know what you mean, corners. Is
the corners of like temples, right? Recede hairline. Yeah. So my hairline refuses to recede. So I actually, for the last 4 years, I've been shaving it.
I know.
You know, and it's like I've just stopped doing it, and it's growing back. And it's like it's the weirdest feeling because I'm looking at the mirror and it's a nice full head of hair, and I'm like so afraid of going bald because the men in my family are bald, and I'm like, would you please recede, but just a little bit?
Just a little bit.
Tiny
Definitely. Bit. Hairline has a lot to do with passing.
It does.
And I told you this before. I had hair loss before transitioning from stress. I haven't had much on T. My hairline has masculinized a little bit because this was round before.
Yeah.
But the length is deceiving. Like if I got a buzz cut now or just a short cut, it would look more angular. And we've spoken about looking like Sinead O'Connor or like Ellen Ripley and Alien.
Yeah.
Which is not the worst thing. They're tall babes.
They're cute. They're very cute.
Truth.
Okay. Is there anything we should have spoken about regarding your revision that we didn't touch on?
Well, I can show you what they've done.
Yeah, let's do that. Go ahead.
Yeah, because my bandage is coming loose here. So
you need to adjust it anyway.
Right. Okay. So I get up.
The Godfather.
I've been waiting for this the entire time.
Oh my God. This is like becoming the job.
You come to me on the day of my doctor's wedding.
Oh wow, you have full range of motion.
Yeah. So you can see.
Wait, oh, it's tiny. Yeah.
Just some ends.
It's a tiny little bandage.
Yeah.
Amazing range of motion.
Yeah. Oh, everything is good. Sure. Yeah. So you can see this is the original from Friday. I'm supposed to keep this on for 5 or 6 days before I change it. And then, like I did it last time, just tape around it as I see fit. Right? So that's all that they did. And here is still a little bit of swelling that goes down. And you can see on the videos that we did before that I had here bunched up a little bit of tissue.
Yeah.
Right?
You had like 2 little tacos on the side.
Yeah, it looks like fat, but it wasn't. So hopefully when the swelling goes down, you see I'm still a little bit orange here from the disinfectant. That is relatively flat. You don't know this. I told you last time, a couple of people need 2, 3, 4 revisions. That's really crazy. I hope I don't need that. But I think we can say either way, the result is aesthetic enough as it is. It's a normal male chest, I think. Yeah.
It is.
So they just
male chest, like early puberty male chest. Yeah. Point blank. No.
They just extended the cuts here. I had to shave for surgery. My God, that sucked.
Fuck shave for surgery. I hated that part.
Under the arms and my chest, I hate it. And when I had the initial surgery, I even had to shave my stomach, which is super hairy. I hate it. Okay. So they just extended the cuts here. That's all they did. Really minor.
I wanted to ask, how do you feel about scar care and specifically silicone strips now that you're going to do the whole scar thing again?
I won't be buying silicone strips because, again, I don't want to widen the scars, and I know that happens for me the way my body is.
Yeah.
I'm looking at paying between 150 and 250 for one package of scar strips with silicone. I'm not going to do that. I get the tapes that I have lying around here, right?
Yeah.
So you can entertain our guests for a moment.
Okay, so I'm going to entertain my guests doing what I do best, which is taking my clothes off. So, these are my results, which I know everybody's just here to watch me take my shirt off. Oh. So I've had surgery about. He came back and I'm naked. I've had surgery about.
Oh no, bro! I've seen so much more. So
yeah. So yeah. So this is like.
We're just gonna let that stand without an explanation, huh?
27 days out, 26 days out, something like this. I'm really having like the pecs. Yeah, they're coming back, you know, range of motion starts to pull around here. I could go further, but I don't want to force it. And the real thing right now is that you see the red shit around the tape.
Yeah.
So this part is like irritated and I have to put ointment on it and it's under the tape as well. This part is irritated, but I don't feel it. I mean, I put ointment on it, but I don't feel it. And I can't show you the nips yet, but they're still there. They're still attached. And the swelling is going down. You know, the swelling was a big deal. So I never had full abs, but I had like the upper two. And now it's like it's coming back a little bit. So this is something people need to know. I think when they're going into top surgery, you're going to have swelling that's going to look like you have a gut. And it's going to fill up your arms. So you're not going to see your shape, you know, like Niki, I think you're a little swollen still, you know?
Yeah,
and,
sure.
Yeah. And you're really going to feel like we've said this before, but you're really going to feel pretty dysphoric about that in the beginning because you're coming out of surgery. You're like, I'm going to look like a man now. And it's like, or non-binary, but like, I'm going to have like a chestless body and it's going to be beautiful. It's like, no, baby, it's going to take a while. You know, it's not going to be beautiful.
To go down.
It's going to take, yeah.
So tape wise, brand doesn't matter. Everyone has different.
Is that Leukoplast?
This is Leukoplast. I have Leukoplast here as well.
Leukoplast.
This is Leukoplast, which I could buy really cheap, like for 2 or 3 euros. And the thing being, this is very skin sensitive. And this is the tape. You can see it's like a paper tape, essentially.
Yeah, it's really
looks like paintings, like painter's tape, right?
Yeah.
That you can do for walls. This is what I've had the greatest results with, both training wise, that it sticks the most, but it doesn't completely tear my skin off. Then I have Leukosilk, which is also for sensitive skin, not as thin at all, much stronger adhesive. It's okay, but can't stay on for as long as the other one.
Yeah.
Then I bought Leukoflex and Leukofix, so just to test, and I didn't really have good results with them. Here, this one is almost transparent. Really great support for the incisions while I was working out, but my skin got red very fast.
Yeah.
This is mostly what they used to fixate band-aids with and whatnot, and gauze. Can't recommend it. Immediately had a skin breakout, rash.
Yeah.
And then the other one, Leukoplast, is so bad for your skin. You cannot put it on wounds.
No. Leukoplast is rigid tape. It's rigid tape. It had very, very, very strong adhesive. And it's made for like ankle bandages for when you have an ankle strain. It's not it's rigid taping. It's different. So like,
and I have 2 other things here because Here, this. Don't. Absolutely don't put this on your scars. That's nuts.
This stuff looks like fabric, and it feels like very tough fabric.
Yeah. This is not for scars, guys, not for wounds.
Not for scars.
Another thing you can use are grit tapes, grit band-aids, acupuncture tapes.
Yeah.
They're great. These are what my surgeon recommends because they let the incisions breathe. So they're not as sturdy as a solid tape would be, but I've had zero stretching, zero pain, zero bleeding with them. 2 different sizes. I'm told some people use them for physiotherapy. Speaking of which, I've used K-tape. What's that? That Kinesio Tape, right?
So there is a brand that's called Kinesio Tape, but it really is just like a product that could be done by various companies, which is basically some kind of fabric-based elastic tape.
Yes.
And it's what we use in physical therapy to do a lot of like functional bandaging, which is when they put like the colorful shit on you, you know, like the athlete tape. Yeah. And I think it's kind of cute it could be interesting for a bandage, for scar care. The thing about that shit is it comes off very easily. The more movement you have in that area, and the chest is really a mobile area of skin, it might come off, and you might need to like tape the corners with something else.
Yeah. My surgeon said to try K-tape. I hated it. And I've had the really unlucky thing happen to me. I've had it on for a week and I kept soaping it up. It won't come off. When you have fresh scars, fresh wound tissue, oh God. Now, it ended up being okay. I didn't hurt myself, but my skin suffered from it. Personally, I cannot recommend K-tape. Someone else might make better experiences with it, and that's okay.
I think a lot of guys have it at home because they used it to bind, you know, like.
Yeah, that's true, because trans tape is the same material. This brand trans tape is the same material that generic K-tape is. That never worked for me because my chest was too large.
Yeah, every time I tried it like made weird shapes, and I couldn't drag it all the way back comfortably because it would like get under my armpit. I had a lot of skin.
Yeah.
And the shape was like, the binder works a lot better for me. I think you really need to have like a very small glandula for the taping to work.
Yeah.
You know? And I think when my scars progress a little bit to the point where I can take the bandage off, which is coming on Friday. It's coming off on Friday. I'm going to try to see if I can get the silicone strips, because in Spain they are like significantly cheaper than what you commented. And see how that works. And there is a little oil that's called Rosa Mosqueta, which is kind of like this vegetable oil that I've been told is very good for scars.
Yeah.
So these are 2 things that I'm going to do, and I'm going to talk about that.
Yeah, I said last time a lot of people here use cocoa oil, jojoba or something. Yeah. I don't. I just let it here naturally.
Okay, last words before we kill the stream.
I can't think of a funny Godfather reference now, so no.
No. You need to watch those movies again.
Agreed.
Yeah, because you got a lot of time of sitting on your ass in the next 3 weeks. So
yeah, and I've already transcribed the entire soundtracks of all 3 movies to the mandolin before I had surgery, so okay, I won't do that.
Can we open the next stream with you playing them?
The entire thing for 3 hours, yeah.
For 3 hours. Okay. Thank you so much, Niki. Thank you to everyone who's endured this amazingly long and overly detailed discussion of unpleasant surgical interventions. And all our like rants about how unfair the world is without actually doing anything to change it. And peace and love and all that gay shit.
All that gay shit, man. We're gay with each other, but it's okay.
So gay around each other.
I didn't transition to become gay again.
I did.
I'm normal now.
I wish I were gay. You know, I wish I were gay. Okay. Bye, people. Have a great one. See you in the next one.